You're still watching Newsday. Thank you for staying with us. Now, regenerative medicine is reshaping modern healthcare, offering treatments that repair, replace, or regenerate damaged tissues and organs, rather than simply managing symptoms. Breakthroughs in stem cell therapy, gene editing, and tissue engineering are opening doors to potential cures for chronic diseases, injuries, and degenerative conditions, while challenging traditional medical approaches worldwide. As the field grows, it promises not only longer, healthier lives, but also significant ethical and regulatory considerations. Now, joining us to explore the latest in regenerative medicine and its implications for human health is Dr. David Ikudayisi, a leading medical specialist in the field. He will discuss how these innovations are being applied in clinical practice, the benefits patients can expect, and the challenges facing researchers and healthcare systems as this transformative science moves into the mainstream. Welcome to Newsday, and thank you for joining us.
Thank you for having me on your show.
Now, this is a whole lot of innovation, especially in Nigeria's healthcare system. Can you talk to us about what regenerative medicine means?
Okay. Like you correctly define it, that is when you take cells from the human being or tissues and use it to repair, restore, rejuvenate any damaged organ or system to normal functioning state. And, the goal is to cure and not just manage. Current orthodox medicine is about managing diseases. So now, with regenerative medicine procedures, we are pushing towards trying to cure where possible.
So regenerative medicine is more like revolutionary in a way.
Yes, it
is.
So
how has Nigeria caught on with regenerative medicine, and do we have the infrastructure to sustain it?
Well, like in our country, Nigeria, personally, I've been practicing this since 2016 in Nigeria.
All right.
So at the beginning, it was kind of difficult because people were not aware of it, except the few that have been traveling abroad. Now, thanks to technology, thanks to internet, people are more aware, it's more acceptable. So the gene therapy part, for example, there's a cure for sickle cell disease already approved in USA, and UK too has a version. But from next year in Nigeria, the UK version, which is less expensive than the US one, is what is going to be used in Nigeria. So the country is working towards that. But that's the gene therapy. The cellular therapy, which is the adult stem cell therapy, that has been going on, clinically acceptable. You don't need a big infrastructure for that. So, but some of the biologies like umbilical cord stem cells or exosomes, these are the things that cannot currently be produced in Nigeria.
Oh.
So they have to be imported. But that is, those biologies that are from you, like the fat-derived stem cells from your abdomen, or your bone marrow, that's one you get from the patient. Even under regenerative medicine, we have platelet-rich plasma.
All right.
People call it PRP. That is your own blood. So those ones, of course, you need to import the supply, the kits, and disposables, but they can be done in Nigeria.
Okay.
I know that sickle cell cure would be a very big breakthrough when it comes to Nigeria because, this has stopped a lot of love stories, but let's not go into that. Now, some people are skeptical when it comes to all of these new inventions in healthcare. What are some of the myths that you think should be debunked in the area of regenerative medicine? Okay.
For those that are really concerned, this is technically safe if it is done the right way. So under stem cell therapy, there is embryonic, which is unethical in most countries, and that is burdens travel faster. So some people may be thinking of that, but it has pluripotent power. Scientists cannot control it. So they now come up with induced pluripotent stem cell therapy. That's when you take the skin, you program it, but it doesn't have unethical issue because it's somebody's skin or white blood cells that are reprogramming, unlike the embryonic that is potential human being. So that's the second. It's in clinical trial now because scientists believe they can control the way it grows. Now, the third one is adult stem cell therapy, and it has limited replication ability. So that negative part that is limited is actually what makes it to be safe. And under that, we have bone marrow stem cell therapy, adipose-derived, that is fat-derived stem cells, umbilical cord stem cells, and exosomes. And bone marrow transplant was started in 1968 when immune disorders were being treated. Okay. So bone marrow has been going on for a long time, so it's safe. They just did not call it bone marrow stem cell therapy then. So it's technically safe.
All right, doctor, how do you determine when to leverage on the body's own healing abilities through regenerative medicine?
Okay, if somebody has a condition that they've been using orthodox medicine to try to treat, that is the current state of medicine managing, and the doctor said there's nothing else that can be done, but the person wants something more. So regenerative medicine said that there's hope. So cases of, let's say, stroke, if you just, let's say somebody has a stroke, they go to the hospital, and if they've been stabilized and they still cannot talk 2, 3, 4 days, they can consider regenerative medicine. When it is acute, it works miraculously. So within 10 minutes, we get patients, even that are 2 months old of stroke, while still treating within 5, 10 minutes, there's improvement, there's changes in their movement, facial expression, speech improving. Patients that cannot talk for 2 years, cannot walk for 2 years in Nigeria being treated. Within a week, they are talking. Within 3 months, they are walking with cane without support, and things like that. Or people or a kid that has maybe alopecia, autoimmune disease, not growing his hair, within 10 months, it's growing afro. Arthritis, that's supposed to need surgery, even stage 4, end stage. The arthritis changes on the X-ray will disappear over time. The pain will be gone in less than 1 or 2 months. So if somebody wants something better than they are doing, they should strongly consider regenerative medicine procedures. The only thing is when it is acute, you can just get away with 1 treatment session, you get a significant improvement, and that may be all you need. If it is chronic, you may need more than 1 treatment session, but you still get some improvement. So the earlier, the better, especially in stroke. Time is brain. So don't wait. Even when you're in the hospital, if you've been stabilized, you can request for regenerative medicine doctors to come over and treat you. If you can't talk, you start talking. If you can't move, you start moving when it is acute.
I like this age of technology where we get to see a lot of innovations, especially in the health sector. And we know the state at which Nigeria's health sector needs a lot of help. But can this regenerative medicine slow down physical aging processes? Because I know that's one big area where those technology, or should I say AI gurus, have been talking about. And also, are there lifestyle habits that support the body's natural regenerative processes, even without treatment?
Okay. The first part is the anti-aging effect. So regenerative medicine procedures really have good effect in slowing down the aging process. So really? It has this anti-aging, yes. I mean, we're all going to die one day, but whether you like it or not. Although, that being said, the people in the gene therapy have the different opinion, but don't let's go there yet. Let's talk about what is simple, the cellular therapy. You can use that, Let's say you're having conditions that is pushing you towards the grave. Your kidney is shutting down, heart problem, even arthritis, diabetics. You can use cellular therapy, that is adult stem cell therapy, to stop the progression, stabilize the patient, and reverse and regenerate that organ. I mean, it is happening. It's not a myth. It's not only in abroad, it's happening in Nigeria. At least at the centers where I work, So things like that is possible. As far as
lifestyle habits.
The lifestyle habits, pretty much, we all know that health is wealth. So if you eat healthy, you exercise, those are the basic things that we all know that help. But when you get older, things slow down. So for example, the bone marrow stem cell therapy, if you are more than 50 years of age, those of us practicing regenerative medicine, we believe that it's better to use other things like your fat. But if you are lean, you have no fat, of course, we still use your bone marrow. But it will still work. It's just not as good as somebody who's 40 or 35 years of age. And these are all happening in Nigeria.
Okay, specifically, I'm sure the viewers would like to know what diseases could be cured by regenerative medicine? As
when I get that question, I always say that it's easier and faster to say what cannot be treated, like, regenerative medicine will not take care of malaria and things like that, because it covers all range of all fields of medicine, from children like cerebral palsy, autism, or to the adult, whether it is diabetes type 1, type 2, arthritis, kidney disease, acute or chronic. I already mentioned stroke earlier. Oh, it's very good for autoimmune diseases. Yes, we said regenerative medicine, that's what regenerative medicine doctors or scientists thought at the beginning, only to find out that these procedures work better for autoimmune diseases like lupus, rheumatoid arthritis, and so on, multiple sclerosis. So there's a lot. Just almost think about it. Yes, it can help. If you break your bone, you need to see orthopedics doctor because that's a structure. It has to be realigned if it is misaligned. Yes, if you use regenerative medicine, it will heal the way it is misaligned. So there are some limitations to what can be done.
Yeah, but, and I was going to throw in the question of costs, but we're already out of time. Thank you so much, Dr. David Ikudayisi, medical specialist on regenerative medicine. Thank you for your time.